Hi, I'm Maryanna Klatt, Director of the Center for Integrative Health and Professor of Family and Community Medicine at the College of Medicine here at the Ohio State Wexner Medical Center. I am the ultimate pragmatist. I'm a researcher, so data-informed decision-making is my absolute North Star, and I love collaborations. And that's why I want to talk to you today, because we would like to come to your organization or company. I'm a mindfulness yoga researcher, and what I do is explore ways to help people become more aware of how we're living, spending the currency of our days. Because our currency of our life is how we spend our time. But we don't think about it this way. The reason that it matters is because it impacts our own ability to function and the type of life that we want to live. My passion in a nutshell is to research the impact of mindfulness when it is sponsored by the organization or workplace, because that makes a difference to the employee to feel like the employer cares about their well-being. For years, I have been researching what causes people the most stress across all workplaces. And people always think it's, too much work. I need to tell you explicitly, the thing that causes people the most stress across every workplace is other people. Too much to do and too little time. Lack of control. Not enough communication, and not feeling valued or feeling seen. We can't control what other people do, and this is the most frustrating thing to us human beings. Up to 2011, my research focus was to deliver stress reduction interventions to a variety of environments and occupations. Something changed, though, in 2011. One day, I looked out my window at the College of Medicine, and I see the James Cancer Hospital going up, and the construction workers were doing yoga and meditation before their shifts, as was required by their employer. And I thought to myself, wow, that is wonderful. That employer cares about their employees. My question was, though, why is this not happening inside the hospital? It's very important what those construction workers were doing. They were building a huge, fabulous cancer hospital. But how about the employees inside the hospital that are also doing very, very important work? It was at that moment I thought, I need to bring my intervention, which is a multimodal approach called mindfulness in motion, inside the hospital. I don't know how that had escaped my vision. Mindfulness in motion is a combination of yoga and mindfulness, personal reflection, scientific evidence, gentle music, and in my mind, the most important piece is the community that gets established. Moving inside the hospital was wonderful. The surgical intensive care unit welcomed me. We did a randomized controlled trial with 32 nurses, and the results were unbelievable. We got a 40% reduction in salivary alpha amylase, which is a marker, a biomarker of sympathetic fight or flight nervous system activation. Their stresses were never going to change. The acuity of the patients, the demands of the work, that did not change. What changed was their reaction to those stresses. and that was exactly what I was after. They felt that it was most important that they recognized within themselves that their stress response was something they were in control of. The other thing that was significant to them was that their employer cared enough about them to sponsor this study. So a brief historical background of mindfulness in motion. Created it in 2004 when I got a very small grant from Women in Science. I spent the next several years doing many different studies where I would always get the same results. Significant reductions in burnout, significant reductions in perceived stress, and significant increases in resilience and work engagement. I was just thrilled with those results. In 2017, the Ohio State Wexner Medical Center started to provide this program for any faculty and staff that work there. People in environmental, people in nursing, physicians, surgical techs, whoever works at the medical center to this day can take the program for free because the hospital pays for it. But I asked myself the question, I have to make sure that those great results on those 4 measures that I get are sustained beyond the change from week 1 to week 8 of the intervention. How long are those great results sustained for? Right before COVID-19 hit in 2020, I finished a study that told me that the results were sustained still at a significant level beyond a year. That made me feel good because I knew we had something there. Then COVID hit for the next couple of years, and I did not want to do this, but I had to go totally virtual because we all know COVID-19 was a very stressful time, especially in healthcare. So during that time, went totally virtual. And the reason that I didn't want to do that is because I did not think that community could be established on a computer screen. I was wrong. We got the same results and better on one of those measures. So what that allowed me to do is scale and disseminate virtually. So even though I did not want to do it, COVID turned out providing me an opportunity to scale and disseminate an effective evidence-based stress reduction program. Then we ended up getting 2 grants from the Ohio Bureau of Workers' Comp, which allowed us to create a mobile app and also allowed us to take mindfulness in motion to firefighters, first responders in the community, and then first responders in other hospital systems within Ohio. So win-win. Some of the improvements that had been requested for years is people wanted an on-the-go practice. They wanted to be able to practice the mindfulness themselves on their mobile phone. So because of the grant from Ohio Bureau of Workers' Comp, we were able to take the website-based mindfulness practices and put them on the mobile app. And it has been a game changer. The other improvement that was requested and delivered was 4 respite spaces across the hospital system. These are quiet spaces, close to clinical spaces, that allow people to do short practices inside them. Inside the respite pod, there is a big TV screen where we have nature videos, we have meditations, and we have some physical workouts, all that are practical and can be done inside the respite pod. I'd like to share the results on the first 695 people that have full data sets pre and post within our hospital system. We have a 28% reduction in the number of people that qualify as burned out from week 1 to week 8, which is 195 people. Wonderful. Perceived stress significantly goes down, but it is the 2 bottom slides that I am so excited about. Significant increases in resilience and work engagement. Who wouldn't want those kind of results at the organization where you work? I mentioned before that the mobile app was effective. I had no idea how much people would actually use the mobile app. This is from a group of 77 participants working in the hospital. Over the 8 weeks per participant, the average time that they utilized the app was 2.78 hours, which seems like an awful lot of time when each video is about 4 minutes. I know people are utilizing the mobile app, and it has increased the results that we're able to get. I'm excited to share that we took the core Mindfulness in Motion program and have now disseminated it to both cancer patients, MS patients, and their caregivers. We have done many employees from municipalities, college students, different states across the U.S., different hospitals across Ohio, and now a hospital in Boston, and even a project in Australia in Tasmania. So we are thrilled, starting small and disseminating wide. If you'd like to talk to us about getting a taste of mindfulness, we would love to hear from you. Thank you.